Hi there. Welcome. It's me, Demi. Now you're on DEMY'S channel. Now I am going to discuss the 11 symptoms of anxiety. Please stay tuned. I will discuss to you one by one the causes and symptoms of anxiety. By watching my video, you will be able to understand the causes why people have anxiety. Please stick around and finish the video. Enjoy. What is anxiety? How do I prevent anxiety? It is feeling of worry, nervousness or unease, typically about an imminent event or something with an uncertain outcome. If you are unsure whether you are experiencing an anxiety disorder, it will help you. I will discuss the mental and physical symptoms so that you can learn how to tell if you have anxiety and start managing it. One of symptoms of having an anxiety are as follow. Number 1 is excessive worrying. One of the most common symptoms of anxiety disorder is excessive worrying. The worrying associated with anxiety disorder is disproportionate to the events that trigger it and typically occurs in response to normal everyday situations. To be considered a sign of generalized anxiety disorder, the worrying must occur on most days for at least 6 months and be difficult to control. Number 2. Feeling agitated. When someone is feeling anxious, part of their sympathetic nervous system goes into overdrive. This kicks off a cascade of effects throughout the body, such as racing pulse, sweaty palms, shaky hands, and dry mouth. These symptoms occur because your brain believes you have sensed danger, and it is preparing your body to react to the threat. Your body shunts blood away from your digestive system and toward your muscles, in case you need run or fight. It also increases your heart rate and heightens your senses. Number 3. Restlessness. Restlessness is another common symptom of anxiety, especially in women and/or teens. When someone is experiencing restlessness, they often describe it as a feeling on edge or having an uncomfortable urge to move. One study in 128 women diagnosed with anxiety disorders found that 74% reported restlessness as one of their main anxiety symptoms. While restlessness does not occur in all people with anxiety, it is one of the red flags doctors frequently look for when making a diagnosis. Number 4. Fatigue. Becoming easily fatigued is another potential symptom of generalized anxiety disorder. This symptom can be surprising to some, as anxiety is commonly associated with hyperactivity or arousal. For some, fatigue can follow an anxiety attack, while others, the fatigue can be chronic. It's unclear whether this fatigue is due to other common symptoms of anxiety such as insomnia or muscle tension, or whether it may be related to the hormonal effects of chronic anxiety. Number 5. Difficulty concentrating. Many people with anxiety report having difficulty concentrating. One study including 157 children and teens with generalized anxiety disorder found that more than 2/3 had difficulty concentrating. Another study in 175 adults with the same disorder found that almost 90% reported having difficulty concentrating. The worse their anxiety was, the more trouble they had. Some studies show that anxiety can interrupt working memory, a type of memory responsible for holding short-term information. This may help explain the dramatic decrease in performance. However, difficulty concentrating can also be a symptom of other medical condition, such as attention deficit disorder or depression. So it is not enough evidence to diagnose an anxiety disorder. Number 6. Irritability. Most people with anxiety disorders also experience excessive irritability. According to one recent study including over 6,000 adults, more than 90% of those with generalized anxiety disorder reported feeling highly irritable during periods when their anxiety disorder was at its worst. Compared to self-reported worries, young middle-aged adults with generalized anxiety disorder reported more than twice as much irritability in their day-to-day lives. Most people with generalized anxiety disorder report feeling highly irritable, especially when their anxiety is at its peak. Number 7. Tense muscle. Having tense muscle on most days of the week is another frequent symptom of anxiety. Tense muscle may be common, it's not fully understood why they're associated with anxiety. It is possible that muscle tenses itself increases feelings of anxiety, but it is also possible that anxiety leads to increased muscle tenseness or that a third factor causes both. Interestingly, treating muscle tension with muscle relaxation therapy has been shown to reduce worry in people with generalized anxiety disorder. Some studies even show it to be as effective, and it has been shown to reduce worry in people with generalized anxiety disorder. Some studies even show it to be as effective as cognitive behavioral therapy. Number 8. Trouble falling or staying asleep. Sleep disturbances are strongly associated with anxiety disorder. Waking up in the middle of the night and having trouble falling asleep are the two most commonly reported problems. Some research suggests that having insomnia during childhood may even be linked to developed anxiety later in life. What is known is that when the underlying anxiety disorder is treated, insomnia often improves as well. Number 9. Panic attack. One type of anxiety disorder, called panic disorder, is associated with recurring panic attacks. Panic attacks produce an intense, overwhelming sensation of fear that can be debilitating. This extreme fear is typically accompanied by rapid heartbeat, sweating, shaking, shortness of breath, chest tightness, nausea, and fear of dying or losing control. Panic attacks can happen in isolation, but they occur frequently and unexpectedly. They may be a sign of panic disorder. Panic attacks produce extremely intense feelings of fear, accompanied by unpleasant physical symptoms. Recurring panic attacks may be a sign of panic disorder. Number 10. Avoiding social situation. You may be exhibiting signs of social anxiety disorder if you find yourself feeling anxious or fearful about upcoming social situations, worried that you may be judged or criticized by others, fearful of being embarrassed or humiliated in front of others. Avoid certain social events because of these fears. Social anxiety disorder is very common, affecting roughly 12% of people in America. Adults at some point in their lives. People with social anxiety may appear extremely shy and quiet in groups or when meeting new people. While they may not appear distressed on the outside, inside they feel extreme fear and anxiety. This aloofness can sometimes make people with social anxiety appear snobby or standoffish. But the disorder is associated with low self-esteem, high self-criticism, and sometimes depression. Number 11. Irrational fears. Extreme fears about specific things, such as spiders, enclosed spaces, or heights, could be a sign of phobia. A phobia is defined as extreme anxiety or fear about specific object or situation. The feeling is severe enough that it interferes with your ability to function normally. Some common phobias include animal phobia, natural environment phobia, blood injection or injury phobia, situational phobias. Those are the 11 symptoms of anxiety. Please follow me on my next video. I will discuss on how to prevent anxiety. Thanks for watching. Please don't forget to subscribe and hit the notification bell below. This is DEMY'S channel. Thank you for watching.